Hi, this is Jocelyn Miranda from BSN Level 3 Block 1. So for today's video, we're going to talk about tracheostomy care. Tracheostomy care is done to keep your tracheostomy tube clean. This helps prevent clogged tube and decreases risk of infection. So what are the purposes of tracheostomy care? First is to maintain airway patency by removing mucus and encrusted secretions. Second is to maintain cleanliness and to prevent infection at the tracheostomy site. To facilitate healing and to prevent skin excoriation. Lastly is to promote comfort and to prevent displacement. Now for the nursing assessment, we have 4. Now for planning, we have to gather and prepare the following materials. Now let's move on to the procedure or the implementation. First is to check and verify the doctor's order. Second is to bring necessary equipment to the bedstand side or over bed table. Don't forget to perform hand hygiene and to put on PPE if indicated. Then identify the patient using 2 patient identifier, which is the patient's full name and his or her birth date. Close the curtain and the door to provide privacy. And then determine the need for tracheostomy care, assess for pain, and administer pain medication if indicated. Then explain the procedure to the patient even the patient is not alert. Adjust the bed to a comfortable working position. Remember, if the client is conscious, put him or her on a semi-Fowler's position. And if the patient is unconscious, put the patient on a lateral position facing you. Put on your PPE, your face shield or goggles, face mask, and gloves. Now for the cleaning of the tracheostomy, the disposable inner cannula. Carefully open the package with new disposable inner cannula, taking care not to contaminate the cannula or the inside of the package. Carefully open the package with the sterile cotton tip applicators, taking care not to contaminate them. Open sterile cap or basin and fill 0.5-inch dip with saline. Open the plastic disposable bag and place within reach on work surface. And then put on disposable gloves. Remove the oxygen source if one is present. Stabilize the outer cannula and faceplate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of the inner cannula with your dominant hand. Press the tabs and release lock. Gently remove the inner cannula and place in disposable bag. If not already removed, remove site dressing and dispose of it in the discard gloves and put on sterile gloves. Pick up the new inner cannula with your dominant hand, stabilize the base plate with your non-dominant hand, and gently insert the new inner cannula into the outer cannula. Press the tabs to allow the lock to grab the outer cannula. Reapply oxygen source if needed. For applying clean dressing and holder. Remove oxygen source if necessary. Dip cotton tip applicator or gauze sponge in cup or basin with sterile saline and clean stoma under faceplate. Use each applicator or sponge only once, moving from stoma site outward. Clean gently with dry 4x4 gauze. Slide commercially prepared tracheostomy dressing or pre-folded, non-cotton filled 4x4-inch dressing under the faceplate. Next is to change the tracheostomy holder. Next is to obtain the assistance of a second individual to hold the tracheostomy tube in place while the old collar is removed and the new collar is placed. Open the package for the new tracheostomy collar. Both nurses should put on clean gloves. Next is that the one nurse holds the face plate while the other pulls up the Velcro tabs. Gently remove the collar. The first nurse continues to hold the tracheostomy face plate. The other nurse places the collars around the patient's neck and insert the first one tab, then the other into the opening of the face plate and secures the Velcro tab on the tracheostomy holder. Check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. Reapply oxygen source if necessary. Remove gloves, assist patient to a comfortable position, raise the bed rail and place the bed in the lowest position. Remove and discard the used PPE and don't forget to perform hand washing. Reassess the patient's respiratory status, including respiratory rate, effort, oxygen saturation, and lung sounds. Lastly is to document all the procedures and all the observations on the client chart. That's all. Thank you.